I'm Michael, and we're here to talk to you guys today about whether or not organ donation should be mandatory.
Okay, so I'm sure all of you have been asked once before whether or not you'd like to be an organ donor when you went to the DMV and got your license. But I'm sure not all of you knew exactly what you were getting yourself into. So what is organ donation? So organ donation is the process of taking healthy organs and tissues from one individual and putting them into another person. It is a relatively new medical treatment, and according to the Institute of Medicine, the first organ transplantations occurred in 1954 between two twin brothers. One brother was donating his kidney to the other, and this worked then because they were relatives and they had the same blood type. And back then, you were only allowed to donate your organs to each other if you were genetic relatives. However, advances in immunosuppressive medicine have allowed unrelated, deceased, and living donors to donate their organs. So who is able to donate? Really, anyone is able to donate. It just depends on the circumstance. A deceased donor, according to Organ Donation UK, is someone who has passed from either brainstem death or circulatory death. Brainstem death occurs when the individual no longer has activity in their brainstem due to a severe brain injury. Also, the individual is not able to breathe on their own and is left on a ventilator. Another circumstance is circulatory death. This occurs when the patient cannot or should not be revived after experiencing loss of function of the heart and lungs after cardiac arrest. It can also be the planned withdrawal of life support after the patient has been in the ICU or ER department. The other type of donor is a living donor. These people donate their organs while still alive. However, what they are able to donate is limited.
The process of organ transplantations is a long, complicated process, and it starts with pre-operational therapy and medications such as immunosuppressive drugs for the recipient. After an organ donor is recognized through either brain death or circulatory death, the recipient is then notified and the process can continue. The process starts when the organs are collected from the donor and then are transplanted to the recipient within a reasonable amount of time. After the surgery is completed, the recipient will go through therapy and more immunosuppressive drugs in order to make sure that there is no rejection or other complications after the surgery.
So, someone who is deceased can save up to 8 lives with one body. And so, someone who's deceased can donate their kidneys, heart, liver, lungs, pancreas, small intestine, and corneas, and then also tissues, which include heart valves, upper body bone, veins, skin, and connective tissue. And a living donor can donate one of their kidneys and a piece of bone from either their hip or knee, and then the placenta.
According to the University of Michigan in 2010, different organs can last different amounts of time outside of the body after collection. For instance, a heart can last up to 4 hours outside of the body before cellular death and degeneration occurs. A lung can last up to 5 hours. A liver can last up to 7 hours. Kidney can last up to 20 hours, and a cornea can last up to 5 days before any sort of degeneration occurs. With improving surgical and storage procedures, these time spans have improved.
So I'm for organ donation. So how many of you here are registered organ donors? So only about 45% of the American population is an organ donor. So some surprising numbers are that there are currently 120,000 people on the waiting list to receive an organ. And every 10 minutes another name is added to that list. And every day 22 people who are currently on the list die from waiting. A transplant gives a person a second chance at life and could overall improve the quality of their life. As an organ donor, you have the ability to save lives. And living donors say that they have received psychological and social benefits from donating an organ. And if the living donor is related to the patient, he or she experiences heightened self-esteem. A deceased donor has the ability to comfort their grieving family knowing that they will live on through another person. So the reasons someone might need a transplant can depend on their conditions. Currently, according to Northwest Life Center, there are 2,600 people waiting for a heart transplant here in America. reasons that they might need it is myocarditis, cardiomyopathy, heart failure, and heart disease. Reasons for needing a liver transplant can be birth defects of the bile duct or the liver, chronic liver infection, hepatitis, and drug or alcohol damage. Reason for needing a pancreas transplant could be diabetes or pancreatic failure, and oftentimes the pancreas and the kidney are transplanted together because they both are affected from diabetes. And the reasons for needing lung transplant can be cystic fibrosis, pulmonary hypertension, emphysema, and pulmonary edema. And then the most common transplantation is the kidney transplant. And reasons for needing that could be high blood pressure, diabetes, or cystic kidney disease. So, fixing the process. So there is much debate on how to fix the issue of the organ shortage. It is primarily focused on the strategies that should be employed to increase both living and deceased donation. With the population aging, there is an increase in end-stage organ failure and diseases such as diabetes and obesity. While the process of retrieval, transplantation, and immunotherapy techniques have advanced, they still have not fixed the issue of the waiting list. Usable organs from deceased donors are scarce, and the waiting list is so long, the only option, according to Anne-Marie Farrell, is to increase living donations. She has proposed to increase living donors, they can give them a financial reward. Examples of financial incentives would be reimbursement of expenses and lost wages or tax breaks. So, what do I believe? So I believe that organ donation and transplantation is a very important scientific advancement and is essential to save the lives of many. Once a person receives an organ, their life will be changed forever. And I think that's pretty cool. And so next time you're at the DMV and you're asked whether or not you'd like to be an organ donator, just say yes, because it's the easiest way to save a life.
I'm going to be talking about the cons against mandatory organ donation. And I'm going to start with the cost of therapy for medications is extremely high. Vandermeer and Rep said that it could cost up to over $1 million for one surgery. The risk of transplant being rejected or having complications is very high too, unless you have the help of immunosuppressive drugs. And if you have rejection, it has high risks of death. Religious and cultural beliefs. Some religions and other cultural backgrounds do not believe in organ transplantations or other medical procedures, which could complicate the process if they do have acceptance or are allowed to perform the surgery. And then from organdonor.gov, only 3 in 1,000 donors, pre-registered donors, are able to donate at the time of death. So like I said, from Vandermeer and Nicholas Rapp, they can be very expensive procedures. A cornea, which is one of the least expensive procedures, is still up to $30,000 without any sort of extra help, including therapy or immunosuppressive drugs. And a heart transplant is $1 million and $400,000. Immunosuppressing drugs can lead to increased risk of death from infection or bacterial or even sickness. What happens is it shuts your immune system down completely so that your body won't attack the new tissues that have been transplanted inside of your body. The types of rejection include hyperacute, which occurs at the time of surgery, usually within minutes. It can be very serious and even life-threatening. Acute is usually within about 3 months of the surgery, and it's not as life-threatening, but it is still pretty dangerous. And then chronic rejection is when, over the years after surgery, the cells in the new tissues degenerate and begin to cause more complications inside the body and other places. And then for religious and cultural backgrounds, I have 2 examples, the Shinto belief system and the Jehovah's Witnesses. The Shinto belief system is very strict about what happens with a body after a person has become deceased. When you're deceased, if you in any way harm or disrupt the body, it is almost illegal, and it's one of the biggest crimes you can do in their belief system. So gaining access to organ donations from one of their um, religious beliefs is very hard, and if you do get compliance from a patient, you have to alter the way that you do the surgery so you minimize any sort of damage or scarring to the body. And then Jehovah's Witness, they do believe in organ transplantations because it is a selfless act and is very generous. However, they do not believe in blood transfusions, which means you have to drain all of the blood out of the organ or tissues before transplantation, which would lead to higher risk of cellular degeneration and complications, because without the blood in the cells, they don't have any sort of nutrients to live outside of the body. And then again, from organdonor.gov, only 0.3% of organ donors can donate after the time of death because of the way they have died or because of other medical complications. So what do I believe? I am a registered donor, and I encourage others to be a registered donor as well. However, I feel that it's your body and it's your choice, and no one should be able to tell you what to do with it. So that is why I believe that it is the donor's choice of whether they are or are not donors.
These are our sources.